Hi everyone, this is Cooper Johnson from GridSpace, where I am the Voice User Experience Designer. I'm here today to talk about how voice AI can be of tremendous help in healthcare. I'll give a little overview of all the ways that, or rather a slice of some of the ways that voice AI can be of use in healthcare. In the end, I'll give a little demo of one particular voice agent to illustrate that a little bit. So I'm a big believer in using voice AI in healthcare because basically the only limit is your imagination for what voice AI can do in that space. Obviously, outside of providing actual healthcare, I think everyone agrees that it's a good idea that our doctors, our nurses, our technicians, our nurse practitioners all remain human forever. But anything that's kind of in a support role or administrative, voice AI can really step in and save a lot of time because healthcare providers are busy people and the human touch, experience, job experience, and just general wisdom, plus, of course, the empathy that comes with also being a human that needs healthcare. Those are finite resources. And we can get a lot more mileage out of all of those things from human healthcare providers if a voice AI is kind of picking up the slack. So let's just look at one particular way in which voice AI could take on an administrative role and save human beings a lot of time. Look at this, what I have here on screen is called a playbook. This is basically the definition of a job that we give to a voice AI agent. And in this case, we've set up our agent Grace to be the phone answerer, the virtual receptionist for a fictitious clinic called Harper Valley Family Care Clinic. In this role, Grace answers the phone, introduces herself, then immediately asks how she can help. And you can see we have a variety of things that Grace can do here independently, which both cover the needs of existing patients, but also enrolling future patients or new patients. And there's some key things here. If we look through the playbook, if someone says they want to enroll as a patient, which I will do in my little demo here, we have what's called the logic node. And at any time, we could use this logic node to set whether the clinic is accepting new patients. But basically, just by retyping one word, we could set that status immediately. And Grace could begin handling inquiries about being a new patient differently, depending on the availability of patient slots. So we'll see here that Harbor Valley Family Care Clinic is accepting new patients, in which case we'll be sent down the road, down a path in the conversation where Grace actually begins some onboarding steps, collecting some basic information about the patient, which could be passed on to theoretically a human being who finishes the process, maybe has some more complex questions or just needs to be there as a matter of professionalism, perhaps legal compliance, and then transfers the call to that human being, but also asks a very, very important question, one that we see come up a lot in healthcare use cases for voice AI, which is screening to see if the patient is eligible for Medicare, which we can do just by a simple screening by asking them if their age is 65 or greater or not. So we'll see that in a second. But just to recap before my demo, Grace, our voice AI, really can do an infinite number of tasks within the healthcare space, providing support to all kinds of healthcare practitioners, healthcare providers, and freeing up a lot of time that's better spent providing care for patients. Okay, so let's visit now the actual execution of this playbook for Harper Valley Family Care Clinic. We'll run what's called a coaching session, where I can see in real time what Grace the Voice AI is hearing and what decisions she's making. And in this little role play, I will play the part of someone who wants to enroll as a patient.
Hi, you've reached Harper Valley Family Care Clinic. If you are experiencing a medical emergency, please hang up and dial 911. Okay, my name is Grace. I'm a virtual medical receptionist. How can I help you?
Can I join up as a patient of your clinic, please?
We are currently accepting new patients at Harper Valley Family Care Clinic. Would you like to begin your new patient enrollment process right now?
Now would be great.
That's great. I just have some quick questions for you. May I have your full name, please?
Cooper Johnson.
I have that name spelled Cooperjohnson. Is that correct?
That is correct.
Do you currently have a primary care physician?
I do not.
And is your age 65 years or more?
No, I'm well under 65.
Thank you for answering my questions. I'm going to transfer your call to patient care specialist who can help you complete your enrollment. One moment, please.
Okay, so there we have it. Grace is able to be the first line of welcoming incoming new patients for this care clinic, ask a couple of questions just to find out a little about them, determine if the patient is Medicare eligible or not, and then pass along the call to the correct department, based on that Medicare determination. So this is kind of just the beginning. We could set up voice agents running on Gridspace Grace to do a large number of tasks, or even do this task in more detail. There's really no limit. Truly, whatever you can imagine, Grace can probably provide that administrative support within healthcare. Have a great day.